Well, during this crisis, we're answering your COVID questions. Go to that hashtag on Twitter or send in an email on our Your Says. Answering these questions for us has been Dr. Chris Moy from the Australian Medical Association and a GP as well in South Australia. Thanks very much for your time again today. One of the questions we're getting a lot is about elective surgery having stopped and private hospitals possibly closing down, which seems crazy at the moment, Chris, for this to be happening when they're needed during this crisis. The question is, what's happening with our private hospitals and the workers inside them?
Well, look, this is the biggest realignment of the health system that's possibly ever happened. So our issue is that the public hospitals, they're kind of fine. They're funded by the government, state and federal. The issue is the private hospitals are really funded by throughput, surgery and patients that get admitted to those hospitals. But the issue is that we need those beds. We need the beds, and we need the staff, and we need the equipment in those hospitals. So what has happened is the decision was made to stop elective surgery because they would be filling up those beds. Ironically, then, that means that these private hospitals don't have any funding, and so they're not viable. So the lights could go out. So in a very, very rapid fashion, the things are happening so that there will be some arrangement where the private hospitals will be either sort of funded, or there'll be some other sort of arrangement where they'll come on board to really keep them open, keep the staff and keep the equipment going so that they're ready. And in some ways, what we're doing is actually aligning all the private hospitals, the public hospitals, and possibly some new hospitals, as you've seen. And we're aligning this a bit like a navy just turning in towards a storm that's coming, and it doesn't happen overnight. And I know a lot of people are ground are wondering why their jobs suddenly in a private hospital disappearing. No, look, I think it's all realigning, and the troops are forming, and give it some time.
Right, so they will use them ultimately. It's a bit, as you say, fluid at the moment, but they'll use those hospitals and staff ultimately, particularly if and when the crisis escalates. This question coming in about infection, which we're getting a lot of, they say the virus can last on door handles for multiple days, glass for 9 days. Can I really get it from my phone after 9 days? And what about food as well? The thought with regards to there's still some stuff that's unknown. Okay, it's still a new virus, but the going rate, as I understand it, is that the virus can sort of maybe stay intact on a sort of a hard surface like plastic or steel for maybe up to 3 days, but on porous surfaces it's a lot less. Food would again be sort of a porous type sort of thing, but it's ingested straight away. Obviously, it could be passed that way. Ultimately, though, this gets back to the main other strategy, which is good hygiene of people handling food, but also when you're actually before and after contacting any surface at the moment, and using hand sanitizer if you can, because that is the major thing. The other thing is that really it is still droplet spread. It's that whole this social distancing thing, the fact that you can spit it on somebody else when if you're coughing and spluttering with the virus, which is still the primary cause. So the surface thing is there, but it's not as important as the droplet spread. You mentioned their food handling. I mean, a lot of people are getting takeaway, trying to support local businesses, and we read it lasts on cardboard for several days. So what's the best approach? I mean, you can bring the food inside, put alcohol in your hands, pick up the cardboard container and put it into a new container to eat. Does that mean you're safe?
It's probability reduction, and I'm not sure cardboard is actually that long. Look, there's been evidence that sometimes the virus can stay on some surfaces. There's been the RNA remnants, the sort of the DNA remnants can stay on surfaces and be picked up, maybe even a couple of weeks after on certain surfaces. That I think it was one of the cruise ships that were found it, but really it's probably less than that. And it gets back to the fact that the food handler needs to use good hygiene, and the person picking it up uses good hygiene and uses exactly the common sense that you've indicated, tries to minimise contact with the surface, and then probably wash their hands before actually eating the food.
As you say, probability, so the virus lasting on something doesn't mean that it's as infectious as it can be if you're touching someone's hand who's just sneezed, for example. The other one we're getting a bit on is testing. So how can we be so sure the numbers we're getting are accurate? New South Wales today was saying they're doing less testing. Well, if they're doing less testing, what are they missing?
Okay, look, I would say to you at the moment, we're still doing quite well, and we're seeing this
hopeful flattening of the curve at the moment, which is probably because of the measures that have occurred over the last couple of weeks, which are hopefully starting to take effect. There's always going to be a delay, and also because most of the exponential rise until the last few days was overseas. The scary bit has always been this community transmission issue and criticism that there isn't enough community testing out, random testing out there. That's usually by people who actually don't do the testing, like myself, and not understanding that it's actually not as easy. And every time you have to do the test, and it's actually burns up personal protection equipment every time you do that. I think still we're still relatively in good position, and ideally we would have tested more outside. In South Australia, we have actually done some of that, but other states, the limiting factor has been the amount of reagent and kits. It was still far more important to hit the overseas lot and the people that are connected to them and do the hunting around there. And again. Okay, we may, ideally we would have tested everybody, but that would never have been possible. The next step is really more important than that, is social distancing stuff now, because even if it's out in the community, what we need to do is close down any possibility of community transmission by this social distancing and social isolation for those people who need to do it.